The European Union's drug regulator, the EMA, said that repeated booster shots at short intervals were not a viable long-term response to the COVID-19 pandemic. The EMA's head of vaccine strategy said on Tuesday the evidence is not there yet to support this approach.
We have not seen yet data with respect to a fourth dose, and we would like to see this data before we can make any recommendation. But at the same time, we are rather concerned about a strategy that entangles repeated vaccination within a short term. We cannot really continuously give a booster dose every 3-4 months.
Israel last week started administering a fourth dose of the Pfizer shot. It's offering second boosters to people over the age of 60, immune-compromised patients, healthcare workers, and the elderly living in care homes. They found it boosts antibodies fivefold within a week. British health officials on Friday said booster jabs are still providing high levels of protection for elderly people against severe disease from the Omicron variant, and there is no need right now for people to have a fourth shot. Cavallari said the EMA has two main concerns when administering a booster as regularly as every 4 months.
We will end up potentially having problem with the immune response, and the immune response may end up not being as good as we would like it to be. So we should be careful in not overloading the immune system with repeated immunization. And secondly, of course, there is the risk of fatiguing the population with the continuous administration of boosters.
He suggested an approach that is more spaced in time, similar to flu shots, synchronized with the arrival of the cold seasons. Cavallari also said, while we're still in pandemic, the endemic stage is quickly approaching.
With the increase of the immunity in the population and with Omicron, there will be a lot of natural immunity taking place on top of vaccination. We will be fastly moving towards a scenario that will be closer to endemicity.
On Monday, Pfizer said a COVID vaccine that specifically targets the Omicron variant of the virus, as well as already circulating variants, will be ready in March. Anna Rodriguez, NTD News.